I always like to say that my first birth was almost my last birth, and
Mm,
that I attended as a doula because it was so traumatic. And I didn't know that women were treated this way, or that there would be so much pressure to make decisions in a certain way. And I had no idea, and I didn't know what to do with that. And slowly, I just started learning and trying things out and using my voice and encouraging parents to use theirs, and realizing that when I used my voice and when they used theirs, we were likely to avoid trauma. And even if the birth didn't turn out exactly as planned, we could all walk away feeling pretty good about what had happened in that birth space.
Welcome to the show, ladies. Today, I have the honor of interviewing Meredith and Alicia from Intentional Birth, and you can find them online at intentional.birth on Instagram. They are one of my favorite doula accounts to follow. They are board certified patient advocates, seasoned advocate doulas, and the founders of Intentional Birth and the Perinatal Patient Advocacy Center. They have doula trainings and trainings for couples to prepare for advocating, especially in hospital settings. And they're going to be sharing with us today all about how to effectively advocate, communicate, and collaborate with medical care providers in your childbirth for a positive experience. Welcome to the show, ladies.
Thank you, Karen. We're so happy to be here with you.
Thank you.
Oh, so just to give you guys a little backstory, I've been following these two on Instagram, and I said I need to have them speak to my doula training group. We have about 50 doulas in a doula mastermind, and they came on yesterday and downloaded so much valuable wisdom with this group. In fact, the doulas were like, where can we find more? I want the resources. I want the slides. I want to go to your trainings. So let me just tell you, you guys are in for an absolute treat. We're going to go over a lot of the very similar things I taught in the doula group for you mamas so that you have tools to learn to really feel confident walking into a hospital delivery, because I know a lot of moms who desire a natural birth are intimidated by having to advocate for themselves or feeling pressured for interventions they don't want to have. So we're going to get into some really practical things. Make sure you stay and listen through, because I promise you this will be worth it. But tell us how you got started in this advocacy work and why is it so important?
Well, I think it started little by little, just simply because I was feeling traumatized. I always like to say that my first birth was almost my last birth, and
Mm,
that I attended as a doula because it was so traumatic. And I didn't know that women were treated this way, or that there would be so much pressure to make decisions in a certain way. And I had no idea, and I didn't know what to do with that. And slowly, I just started learning and trying things out and using my voice and encouraging parents to use theirs, and realizing that when I used my voice and when they used theirs, we were likely to avoid trauma. And even if the birth didn't turn out exactly as planned, we could all walk away feeling pretty good about what had happened in that birth space.
Yeah, I was similar in that my doula training actually trained me not to speak to staff. Those were words that were said to me in my doula training. And I found out really fast that that does not work well, because it makes the staff really suspicious of you as a doula. They're wondering what you're saying behind the scenes when they're outside the room. It creates silos in the team. So you, as the one who really knows this family and their values and needs well, aren't communicating with the people who understand the medical side of things, and there's communication breakdowns. So I learned really fast that's not the way I wanted to practice. I saw other doulas doing it differently, and that gave me the freedom to start experimenting and exploring and realizing I didn't have to do it the way I was trained.
mm,
And I became a patient advocate. And what that meant was that I'm a member of this team. I walk into the room and I talk to the nurse. I introduce myself. I tell her I'm excited to work with her. I let the staff know that I'm here to help facilitate good communication. My clients know I'm there to build a bridge, to help them understand their options, and always to represent their needs, wishes, and values, and elevate their voice and center them as the decision maker on the team. And the result has been that over the years, as I've grown more and more into this advocacy role, I've seen, like Alicia, far fewer traumatic births, far more families coming out of birth feeling like they had If not the exact birth outcome they wanted, they had the experience they wanted where they felt like the decisions were coming from them. They felt empowered and respected by the whole team. And they felt like there was at least one person who was there listening to them, honoring their choices and believing in them. And I just like this way of doulaing a lot more.
Yeah, it sounds like it's more empowering for the doula and especially the mom, which is what's really
Yeah.
important. And I think you hit on something so powerful that I often say is that it's not what happens in your birth that makes it traumatizing. It's how you were treated. It's how you felt treated. And I've seen women have everything go wrong that could go wrong in their birth, and they felt so positive about it because they felt like they were still the one in charge. They were honored and respected. And on the other side, I've heard women have everything go right on paper, the most beautiful birth you could ask for, and yet they felt traumatized because they felt like their power was taken or they gave their power away and they weren't really the one leading and being honored. And so what you do is so powerful. And even in the natural birth space, I find often a demonization of hospitals and doctors and medicine. And yet so many women, and as a home birth, advocate myself, I've had 3 home births and I fully believe in the safety and beauty of home birth. I also recognize there are so many women that don't have that option for a variety of reasons. And what you're doing is creating a path where women can confidently birth in the hospital with these skills of advocacy. How are some ways you've seen these skills really come to play or shift or change a birth in a hospital?
Yeah, and I think I just have to jump in and say, like, it is harder in the hospital.
Yeah.
Like, if you want a natural physiologic birth, the reason our programs exist is because it's hard to get it in the hospital, where people
Yeah.
aren't necessarily trained in that kind of birth. They're not comfortable or familiar with it. It's not their specialty. And so we do need, and your desires and wishes are probably going to rub up against hospital policy. That's why advocacy exists. So,
Yes.
but yes, you're right. There is a pathway. And that's what that's what we've worked to create for our clients. We've had a lot of amazingly positive hospital births that were very physiologic and even to the point of being practically undisturbed. So it is possible, but it takes a lot of work. And for that reason, we are also home birth advocates for people who really want that kind of birth. A lot of our clients do choose home birth once they realize that their values aren't really aligned with the values of the hospital system. But it's absolutely true that hospital staff, the nurses and the doctors there, they are not the problem. They often have different training. They have different pressures behind them that might make them make a recommendation that isn't right for you, but they want a good birth for you too. They want you to feel loved and respected. Their hands are sometimes tied in the ways that they can offer that kind of support because of the system they're working in. And so, yeah, well, I think one of the very first, most basic principles of advocacy is really humanizing everyone in the room and seeing kind of behind the scenes, why are they saying the things they're saying? Is this person looking at me really grumpily because they actually haven't slept in 24 hours? Did they just make that snide remark about my birth plan because they had something traumatic happen last week? And just be as human as possible. It doesn't excuse anyone's bad behavior, but to just start from a place of connection and humanity, acknowledging people's emotions is really powerful.
I think it's also important to note that people are not inherently good or bad. I think when we like someone and enjoy being cared for by them, for instance, in the hospital, it's probably because our values align. We have a similar way of looking at the world. We choose to view birth through the same lens. And when we're bumping up against opposition, it might be simply because we have a different set of values. And their idea of what a good and safe birth might be different than what your idea of a good and safe birth is. I think for the most part, hospital staff, they want mom and baby to come out on the other side alive and well. But I think a lot of the clients that we're working with and us as doulas, we're looking to go deeper than that. Live mother and baby, that's an important standard, but it's a very low bar.
It's the bare minimum.
It is the bare minimum.
Yeah.
Like we care about, okay, so her body, she's alive, her baby's alive, but what else? how is her mind? What state is her heart in? How does she feel about everything that happened to her and what was said to her? And I think that's also, we need to recognize that too. Their bar is safety, and safety just means live mom and baby.
And a healthy baby, but a traumatized mom isn't really a healthy baby.
Exactly.
We need mom healthy in every area. What are some things that mothers, families need to know going into a hospital about patient rights and their rights in the whole hospital culture?
This is pretty universal. And if we're talking mostly to a United States audience, we can talk about that you do have legally enshrined rights as a patient here. And this is going to be true in most countries where there are laws in place that protect your right as a patient to make decisions for yourself autonomously. And this means that you have the right to information about potential treatments, and then you have the right to accept or decline those treatments. So one thing that confuses a lot of people is that when they get to the hospital, they're told that there are hospital policies that they need to do XYZ because it's hospital policy. Perfect example is that in fact, every hospital that I've ever worked in is going to say it's policy that every laboring patient has a saline lock. So this is for the IV to be able to be connected to in case there need to be IV medications delivered at some point during the labor. Well, so they'll say it's hospital policy, you have to have a saline lock. What that actually means is that it's policy for the hospital to recommend the saline lock to every laboring patient. That's the policy. But the policy doesn't apply to the patient. The patient can say, after considering this option, I've decided to decline, or I would like this alternative, or tell me about my alternatives. And that's the right of the patient. 100% of the time, there is no case where that right is taken away from you unless you are deemed unfit to make decisions for yourself. And that's just not the case for the people listening to this podcast. So one thing to be aware of is that the hospital staff aren't always very educated about patient rights. There might be a nurse that says, well, it's policy, you have to do that. And she genuinely believes it. So sometimes we actually have to come in and be the ones with that knowledge and be empowered with that knowledge of our rights so that we can educate them. ACOG, it's the American College of Obstetricians and Gynecologists, they have a very strong statement. It's a position statement from 2016 called Refusal of Treatment in maternity care, I think, refusal of medical treatment. And they say that a decisionally capable patient can decline any treatment, even treatment that is intended to save a life. That is how far your rights go.
Yeah, that's a strong statement.
Yeah, you could even decline a treatment that is intended to save your life. So yeah, walk in there understanding that if you don't want something, if it doesn't feel right to you, you can say no. That doesn't mean you should say no. There are times where, of course, a treatment is going to be medically necessary. And that's where this information gathering comes in. You should understand your options. You should get second opinions. You should ask about alternatives. But in the end, the decision is 100% your decision.
Yeah, that cannot be understated. Like, that is such important knowledge for any woman, any family to understand. Really, every human ever getting medical care, we need to understand this, but it's often the most overlooked, especially in maternity care.
And there's an element of, I mean, it's big to say this, to say that you can make any decision you want, because that also means that you are responsible in a sense for what comes next.
Yeah.
So it's a really mature thing to say, I take this responsibility upon me, and whatever outcome, I accept that. And I think the reality is that women maybe haven't had that opportunity before. So this may be their first opportunity to really own every decision that they're making, and to recognize that really in the end, we want them to be able to look back and feel great about their decision. We don't worry about how anyone else feels about it, how the doctor or midwife or nurse, but how does she feel about it? Because she alone will live with that decision going forward.
Yeah, so true. You told a story yesterday that just came up for me, and I would love for you to share that again about how you used the advocacy work in a hospital with one of your clients that had a VBAC that was very traumatic in a hospital transfer, and then the kind of birth they were able to advocate for in the hospital. Would you share about that? I feel like it just so beautifully demonstrates what you do and what we're talking about today.
Yeah, and just to clarify, they hadn't yet had a VBAC. So their first birth was an emergency cesarean under general anesthesia. And their second birth, they wanted a VBAC. And so that's a vaginal birth after cesarean. They hired me again as their doula. And so I'm gonna just talk about the process I went through with them. This is the process we go through with all of our clients that has really good outcomes in terms of the way staff receive and treat us. And we've had a lot of doulas replicate this around the country and have told us that this is working really well for them. So this is something that you can pursue as you're planning your birth, and it starts with values. So I sat down with this family and I said, let's talk about what your values are for this birth. What really, really matters to you? Because those values are what we get to come back to every time we're making a decision. They're going to be our guiding stars that we're navigating by as decisions come up for this birth. And the values they came up with were consent, because in their first birth, they had felt really out of control when the C-section happened. Their second value was physiology. They wanted physiology to lead. They did not want to be seen as high risk. They wanted to just allow their body to do, and my client wanted her body to be allowed to do what it needs to do with patience and with respect. Another one of their values was patience. That was one of the top values for them. They did not want to be rushed in this birth. I had explained to them that sometimes that is the difference between a successful and unsuccessful VBAC is just the patience of the team. They don't always love to wait for births to unfold in these situations. They established these values. We opened the birth plan, one-page birth plan. This is our format for a values-based birth plan. The top has an opening paragraph, and their paragraph said something like, this is what happened in our first birth. When we came to your hospital, we felt uninformed, bullied, judged. We felt out of control and traumatized by our experience. This time, we want to feel informed. We want to feel respected. We want to feel like you're on our team and that you care about us. And then they said something about our birth plan. We know our birth plan is out of the norm. Please don't feel like you need to walk on eggshells with us. We really want to communicate with you fully about all of our options. Then they started bold heading my birth values. And they had in bold right next to each other their four primary birth values: consent, patience, autonomy, physiology. And then they listed a few more. They expounded on those values a little bit. And one of the things they said, and this is an important, we call this the flexibility clause. One of the things they said is, my informed decisions found below are based on my current health status and on my values. I may choose to change them if new information arises. And then the next bolded heading is my informed decisions. And after that, they say that this is where we get into that typical birth plan stuff. I declined the saline lock, et cetera, et cetera. And one page, that all fits on one page. Intro, my birth values, my informed decisions. And so we wrote this birth plan together, and I was like, whew, this is a home birth in a hospital that they're wanting here. And not only that, like, this is a VBAC, and your listeners may or may not be aware that for VBAC birth, there's often a lot more policies in place in the hospital, right? They want you on continuous monitoring. They want to be really aware of the progress of the labor and how things are going. And my client really wanted a home birth. And so now you might ask, why didn't she have a home birth? And that's because her first birth actually had been a home birth transfer. And the transfer was so traumatic for them that even though they really loved their home birth experience, this time they didn't even want there to be a shadow of a chance that they would have another transfer. So they decided to start in the hospital. So this is it's a pretty good hospital, but it's also a hospital, and I've seen some unfortunate births there, new treatment there, but also some really good treatment. But this is a hospital that does not do water birth, for instance. They're not radical in any way.
They're a typical hospital.
Yes. So after my client had written this birth plan, they didn't just pack it away and put it in their birth bag and say, okay, we're gonna bring this on birthday. They said, okay, next step in the birth process, they're going to take it to every single prenatal. And they did. They took it to every prenatal. They talked with every care provider on that team about the birth plan. Well, I'm not sure if this happened with them, but one more step we recommend is that at least one of those care providers signs the birth plan and puts it in your chart. And what they're signing is not, I agree with everything on this birth plan. What they're signing is, I have had a thorough discussion about the risks and benefits and alternatives with this client. Because then a later care provider can look at that in the chart and be like, all right, they've already had this discussion. I don't have to badger them and have it again. They might want to, but you can direct them to that chart and say, I already had this conversation. I still feel confident in my decision unless something changes. So my clients did that with every provider. They called the L&D unit and asked to speak to the charge nurse. They're not in labor yet, right? This is a month before they give birth. Called and asked to speak to the charge nurse, told her what was on their birth plan, what they were planning. They just made sure that the runway was constructed before takeoff. Right? With this team,
so smart.
And then we went in on birthday, and the charge nurse greeted us and said, hey, we're going to go straight back to your room. We didn't do any of the triage stuff. We went straight back to the room. They took us to the one room with the tub.
Wow, you got like a free pass, skipped triage.
Exactly. And important note, one more point in this process. We called the hospital when we were in labor at home and we were thinking we were going to be leaving soon. We said, we're coming in. The dad is the one who called in, and he's the ideal person for this job. He called and said, we're coming in. Told them their names. They reminded them about this birth plan so that they knew, okay, that family's coming in today.
Wow.
And he said, could we get the nurse that really loves physiologic birth? We want her on our team.
Yes.
So we've prepped them. They know in a half hour or so, someone's going to show up who wants that nurse, and they can rearrange the floor as needed.
Yeah. And I love even just that tip alone, requesting a nurse that is experienced in physiological birth can change everything. Even if you don't do everything else you're saying in the story, even just that one thing, they immediately sets them up to be like, oh yeah, we have, Sally over there. She loves natural birth and she has all the tips and the peanut ball and the, all the things, and gets excited about it. You're going to get way less pushback when you have a nurse that's on the same page. So I just love that.
Yeah.
So what happened next?
Well, so we get to our room, and I'm thinking this whole time I've put on my advocacy jacket because I know what's on their birth plan. And I'm thinking we're going to have to do some advocacy. I was hoping that everyone would, rally around us. And so far they were, but they knew what was on that birth plan. My client's husband, when I was getting her into the tub, she was now in active labor. While we were doing that, he was walking through the birth plan with the nurse, making sure that they were, again, this is not, you don't just do this one time. When you
you got to have these conversations over and over and over.
Sure she knows they were completely already aware, and she'd already reviewed the birth plan because it was on file. And no one ever even offered electronic fetal monitoring.
Wow, for a VBAC mom.
Mom. They did. Wow. They did intermittent monitoring with a handheld Doppler the whole time we were there. And no one even offered a vaginal exam. Because
not even when she got there.
Yeah, no, not even when we arrived, because she had said on her birth plan that she would request one if she wanted one. So she never had a vaginal exam. She never had electronic fetal monitoring the whole time. She didn't have a saline lock. And she just got in the tub and continued her birth. And her husband was in the tub with her, and I was standing near, outside the tub, and just it felt like this sacred triangle. And the midwife would come in here and there. The nurse was in there most of the time, and they just stood back and watched, and were just witnesses. And then I started thinking, when are they going to ask her to get out of the tub? Because this hospital doesn't do water births. And I just kept expecting it. And it wasn't even on her birth plan that she wanted a water birth. She wanted to labor in the water, but no one ever asked her to get out of the tub. And I was like, the baby's coming. Midwife swoops in, catches the baby in the water, hands the baby up to mom. And it is this amazingly euphoric moment where she got to this time witness her baby's birth and this time actively be a part of it. It was incredibly healing, I think, for their family. And then she got out of the tub, came over to the bed. We waited 90 minutes for the placenta to be born. And you should know that in a hospital setting, most of the
That
time
is unheard of.
they're getting a little bit
Everything
anxious.
is unheard of that you're telling me right now.
Normally it's around like 20 minutes after birth that they start talking about, let's do something to get this placenta
They get antsy and start tugging on the cord. Yeah,
exactly. And so 90 minutes and just a kind of like patient silence, really. Like I was, if anything, the one who was like, maybe we should get into a more upright position, or, like trying some things with her. But it was beyond our wildest dreams, right? But it wasn't by accident that happened. Yeah. Absolutely, the stars aligned that day. I think prayers were answered. We had an all-star team at our side that day, people who were willing to stretch themselves for us. Not everyone's capable of that kind of stretchiness in the hospital L&D world. So we had a great team. We had a team that actually listened, who felt the human story in that birth plan and who wanted to be a part of it in a positive way. And also, I credit my clients for their preparation, their intentionality, their values-based decision-making for the result that we got that day.
It's absolutely incredible. Every piece of that story is like, I mean, they would typically tell you, no, you can't do this, you can't do that. You have to have continuous monitoring. You can't labor in the, you have to get out of the tub. You're a VBAC, so we have to, all the things. And the fact that she got all of that with advocacy. And I love what you said. It's not by accident. Like this, it wasn't just like, oh, we got a nurse that did, loved water birth and didn't tell us to get out of the tub. Like, no, you prepped them, you trained them how to treat you. And then the rest, like the cherry on top, even of having that delivery in the tub and having the full golden hour, and just incredible. And I hope that encourages those of you listening who are planning a hospital birth, who are fearful of, are they really going to respect my wishes, or am I going to have to fight? And so much of, I think, unfortunately, how we prep our clients comes with our own, as doulas or childbirth educators, we bring our own baggage to the table and we create more fear, and it creates this combative environment where we feel, then our clients feel scared and feel like they have to fight for everything, and not without good reason. There's certainly legitimate plenty of stories of abuse and mistreatment. And so understandably, that is a fear, but it polarizes the birth team and it polarizes the patients and the doctors. And I just feel like your approach is so remarkable in that it brings everyone together and humanizes the whole process, and humanizes the medical staff, humanizes the mother, humanizes the doula, and then we all work together. So like, kudos. Like I feel like I would give you a standing ovation. Like this and this mom. It's just so beautiful.
My clients. They definitely deserve that standing ovation.
And you did the work together. It was so beautiful. Can you go over and share with us some tools that families can use in the birth room to advocate for themselves?
Yeah, and I think it probably needs to be said right here is that advocacy is a team sport. And we've got to have everybody on this team, mom, her partner, and if they have a doula, the doula as well, or the family member, whomever's coming with them. So everybody's got to be preparing in the same way. Everyone's got to be ready to show up. And that's because it's really not effective for just one person to be playing the part of an advocate. We need a chorus of voices to make it truly effective. So there's got to be the preparation on the front end. So the learning about what your rights and your options are in the hospital, understanding what Meredith and I like to refer to as the secret menu at the hospital, because the reality is what Meredith was describing, intermittent monitoring with the Doppler, no vaginal exams, waiting for the placenta to be born, all of that is all an option for every mom. She just doesn't know that's an option. And so finding yourself a doula who's going to help you open up those options to you. I'm speaking to moms here, just finding a doula who really understands the hospital, who understands your rights, who knows that there's so much more for you than just kind of the standard of care, the assembly line care that many American women are getting today only because they don't know that there's something else that they could be getting.
Yeah. Hence the secret menu. I like that.
Exactly. So know it's on the secret menu, and then just know you can pick and choose, exactly like going to a restaurant. And I think that's important to frame birth that way. When you walk into a hospital, I think our tendency is to give our power away because suddenly we think, well, they're the experts and they know better than I do. But that's simply not true. They know an awful lot about birth, but they don't know much about the mom herself who's giving birth, and they don't know about this baby. That's knowledge that only she holds.
Mm.
And so holding moms up as the true experts in birth, everyone else around her is an advisor. They might be a very wise and experienced advisor, but they're an advisor nonetheless. And I think so understanding her real role at the center of all the care, it's mother-led, mother-centered care. And so if she understands her role, then she's better able to show up and play that role. So we want to make sure she's taking on that responsibility. She understands who owns this birth. It's her who's in charge of it. She's the birth boss, as I like to say. And the partner is the birth guardian. And the doula hopefully is showing up as an advocate. And when you put all of those pieces together, that is a rock star team. That's a kick-ass, we're going to have the kind of birth that we want kind of team. So preparing ahead of time for that. But then on the day of, again, this is all practicing and prepping for this. This doesn't just come willy-nilly in the moment.
Yeah.
So first of all, what Meredith pointed out, having the partner call the hospital, that's where it all begins. So they know who they're about to get walking through their doors. You know, it's a little bit like this. My sister used to work at a very snazzy restaurant in Arizona where a lot of celebrities come for dinner. And sometimes they might get a call ahead of time, you know, like, oh, so-and-so's coming tonight. Like, let's get, you know, we've got to be on our best tonight. And it's a little bit like that. Mom is showing up and she is a celebrity. So let's let everybody know who's walking through their door tonight. And so calling the hospital ahead of time and letting them know what it is she wants. So if Meredith and I happen to specialize in physiologic birth, that doesn't mean every mom wants that. But we use that as an example because it is the hardest kind of birth to have in a hospital. It's a lot easier if you're going to show up and just do the usual kind of care, get the epidural, you know, etc. You won't meet as much opposition along the way. But if you want anything that's kind of out of the ordinary, you are going to meet that opposition. So get ready for it. And okay, so calling them and letting them know is the first step. This is the kind of family we are. This is the kind of nurse that we need. Because remember, you are paying for this experience. So no different. Back to that restaurant analogy. When we go to a restaurant, we expect that we're going to have excellent service. We're going to have excellent food. We're going to have an overall excellent experience. And that's the same at the hospital. But somehow we don't have that same standard for a hospital. We think we'll just take whatever we're going to get. They just give me the special of the day. I don't know what it is, but go ahead and give it to me. That's what we walk in with. And what I always tell people is, what if the special of the day is liver and onions? What if you don't want liver and onions? So really helping them understand what it is that you want. So it starts there. And then I'll say one more piece and we'll turn it back to Meredith. The next step is making sure that partner takes the reins from here. And we call partner the guardian of the birth for good reason. It's important for the partner to have this opportunity to step into this role, to really grow into this role of protecting this mother and baby, because that's a role the partner will assume forever. And this is the first opportunity to really do that in a powerful way. And so with the partner as the guardian of the birth, when we walk into the hospital, what I would do with clients is we would hang back. Mom and I would hang back, and partner was the one talking at the nursing station, like, okay, we're here, da-da-da-da-da, who's our nurse, signing in and doing all of that. Then once we get into a room, partner's still leading the care. Mom and doula step into the bathroom, back into this safe little birth space, birth cave. And meanwhile, partner's handling things. The first thing the partner gets to handle is figuring out whether this nurse is someone who's going to be a team player. Do we want her on our team? Does she want to be on our team? And partner does that by going through the birth plan line by line out loud with the nurse. And that lets her know exactly who these parents are. It also allows the birth partner to see, what is this nurse about? How does she feel about what I'm sharing with her? Is she on board? Because if she is, cool, she gets to stay on the team. And if she's not, then maybe we need another team player here in her place. So partners vetting the nurse that way. Not only that, but partners doing things that mom doesn't have to do them. So for instance, if mom is in the throes of labor, the last thing she wants to do is answer all of the intake questions. So partner has a set of intake questions already filled out by mom ahead of time, and partners reading the answers to that nurse and going through that. So taking care of all the business end of things so that mom doesn't have to do that. So that when she emerges from the bathroom, she's just going to continue laboring, doing the most important work that she's doing. And partner's going to do the same thing with whoever the provider is, that midwife or that obstetrician who's on call at that moment. For mom, if they're there at the hospital, partner's going to go through the birth plan line by line and then talk about it with them. And probably some advocacy is going to come into play at that point.
So let's talk about if you do need to decline something that is being recommended for you and how to do that well. I think it's important to understand that one of the biggest barriers to evidence-based recommendations is the fear of liability. It's really underlying a lot of what happens in the hospital. It's definitely the foundation of hospital policy is how do we protect the hospital and the hospital staff. In the case of liability, a perfect example of that is the fetal monitoring, right? We think, oh, of course, fetal monitoring is keeping babies safer. Actually, that there's no evidence showing that we have improved outcomes for moms and babies with continuous fetal monitoring. What we do have is a paper and ink record of every heartbeat and every contraction, so that if a lawsuit is brought against the hospital, they can pull up that record and show that they acted in a reasonable way based on the information that they had. So that is why that policy is in place. It's not to protect moms and babies. We don't have evidence showing that it does that.
Right.
It's to protect the hospital. And so knowing that that is concern, for practitioners and institutions alike, is important going in. It's not the only pressure on them. There's also insurance consideration. There's also the things we talked about, training and trauma. But just coming back to liability, what your provider wants to know when you're declining something is that you really do understand what you're declining, that you understand any risk you might be taking by declining that. And they want to know that you're taking responsibility for it, so you're not going to sue them if your decision actually leads to a bad outcome. So let's take the example of, it's really common for a provider to recommend induction by 41 weeks. Some people are recommending it at 39, so really common to recommend induction if pregnancy gets to a certain gestation. So let's say you've done your research and your provider, first of all, let's talk about just gathering information well. One thing that unfortunately a lot of providers resort to if they have, and I don't even think this is necessarily evil. I think that they genuinely want the safest outcome. And to them, that means eliminating as much risk as possible. And so sometimes they use scary language to kind of lead you toward that decision that they want you to make. But for instance, some providers will say, your risk of stillbirth doubles between 40 and 41 weeks, right? If so, you should induce now so that you don't have this doubled risk of stillbirth. So that sounds super, super scary. One way you can ask for, one of our tools is gather meaningful information. So that is not meaningful information. That's just a scary
tactic.
So let's turn it into meaningful information by asking, what's the absolute risk of this happening? So then you realize, well, at 40 weeks, 7 out of 10,000 babies will be stillborn. At 41 weeks, 17 out of 10,000 babies will be stillborn. Yes, it doubled. And it's still a pretty low, the absolute risk is still very low for stillbirth in absence of any particular risk factors. And so that's your first step, is to just gather meaningful information. You can also ask your provider, how often have you seen that happen? Or what would you do if this did happen? Another really important question is this something you recommend for every woman at this stage of pregnancy or at this stage of labor? Or is there something particular in my case that's making you feel concerned? That's your pathway to personalized care. But let's say
I
you've
like
got
that.
all that information and you've decided, no, I actually want to stay pregnant. I want to wait for spontaneous labor. I don't see any particular risk factors in my case that mean I should be induced. So I'm going to decline. And your provider has told you, I would like to see you be induced tomorrow. So here's a tool, and we call it the Own It tool. So you're going to own your decision. You're going to say the things your provider needs to hear. Step 1 is, I understand what you're recommending. Step 2, I understand why you're recommending it. Step 3, I am choosing to decline, and I take personal responsibility for that choice. That's what they need to hear from you. And it's probably going to keep you from being badgered continuously, because they've heard it very strongly from you that this is the decision you're making. They also might want to hear that you will be willing to change your mind if circumstances change.
Yeah.
Maybe something comes up and your blood pressure is now really high, or you're not feeling fetal kicks that you want to feel. Something comes up where now you decide to change your mind. They often like to hear that as well. But I understand you're recommending induction. I understand that the reason you're recommending it is because of a small increased risk in stillbirth. And I am choosing to decline your recommendation, and I take responsibility for that choice. So that's a tool
So
you can
good.
use at any point that you're declining something.
And it just opens up the conversation so that doctors know, oh, you do understand. Because I think so many professionals just have a view that, like, well, I'm the expert. You don't know what you're talking about. I've gone to school for 10 years, and you can't compare your Google search with my, residency or whatever. And we hear these kinds of things, and they actually say them at times. And it takes a bit of that power imbalance. That's why I love this a method, is that it takes that power imbalance and kind of flattens the field a little bit. Like, thank you for the recommendation. I hear that. And I understand why you're recommending it. I understand the risks. It's saying, hey, I'm not just whatever judgment is in your head or a presupposition about me and what I know, but I've actually done the research. But it takes it in a way that's like, you don't have to explain yourself. And I think so many women get caught up in that downward spiral of trying to explain themselves or arguing about the science and the evidence of why do this and why this is important. It's just simply, thank you for the recommendation. I'll consider it, or thank you, I understand. I've done my research and here's my decision, and period. Like, it doesn't need to be an argument. So I just love it. And that's helpful in any situation.
Yeah. And I think that, just to emphasize what you said, Karen, like, you don't have to say any of this stuff. No is enough. Like, no is enough. You do not have to explain. You do not have to apologize. You don't have to kowtow. No is enough.
Yes.
And so if there's time to have these conversations, I love the Own It tool, because it helps to pave the way for continuing good communication and good relationship. But if you are in the throes of labor and someone is telling you that they want this thing done and you don't want it done, no is enough. And you don't have to explain yourself or use the Own It tool.
Absolutely. What are some of the really powerful, like, one-liners you can use in labor in situations like that?
One of our favorites is just 5 words. And this is something a partner can use. So let's say a provider is about to do something that a mom doesn't want. Maybe the provider is about to cut the cord after the baby's born, and the mom has specifically said she wants delayed cord clamping for 3 to 5 minutes. So the provider picks up the scissors, heading towards the umbilical cord. The partner can put their hand up and physically, kindly stop the doctor or midwife and say, we do need her consent. And when you use the word consent, you are speaking hospitalese. They have their own language, and you suddenly are speaking it. And that's powerful stuff. It is the best way to stop whatever's happening in the room and help everyone to pause for a moment, because that's the legal reality. Oh yeah, we need to ask mom if she's okay with this. And then that cues her. This is again where you can practice ahead of time. That cues her to either give her consent or to decline whatever's being offered.
It puts the power back in mom's hands where it belongs.
Yeah.
I love that.
Another really powerful tool is please document that. So, and this tool is often really helpful for a nurse to hear because it takes the monkey off her back. She's documenting, she did her job. She's documenting that she did her job. She told you that she needed to do a vaginal exam, and then you declined. So let's say the nurse has said, I have to do this vaginal exam right now because the doctor out in the hall told her she's got to do it. And so she's saying, I've got to do it. You've said no. She said, well, we really need this information. We've got to do this vaginal exam right now. So she's not just taking no for an answer. This is a time a partner can say, please document, or the mother could say, please document that I am declining a vaginal exam at this time.
Yeah.
And so
now there's a paper trail.
Yeah, the nurse has to go document that. One that has come up for us a few times in our careers is a nurse refusing to turn down Pitocin when a client has requested, or to turn it off if a client has requested. And
I've experienced that too.
Yeah, and we have actually seen this lead to, not in my own personal practice, but for doulas that we've mentored, lead to actually bad outcomes for the baby because the Pitocin was not turned down. And so you really have to trust a mother's instincts. If she's saying this Pitocin needs to go off right now, you've got to listen to her.
Yeah.
But
especially in the pushing phase, I've found it actually can be counterproductive.
Exactly. Right. Yeah. And so hot tip for parents, if the doctor's saying, I don't like the way the baby's looking, we need to go in for C-section. Well, shut the Pitocin off first.
Step one.
Seriously. Yeah, no, I had that situation myself where I was going to say, hey, actually, can we turn the Pitocin off first and see what happens? And the doctor, it's like that it hadn't even occurred to her yet.
Wow.
She put the Pitocin off, baby recovered, and we had a vaginal birth. And she'd been saying it's time to go to the OR. So put the Pitocin off first. But sometimes we've had nurses refuse or try and talk a mom out of it. This is a great opportunity to use this tool and say, please document that I am declining Pitocin. And that's strong language.
Yeah.
She has to turn it off.
Because then what happens is they have a record that she requested it and you didn't do it.
Right. Yeah. So you document it. It's a great idea for the partner to take a picture of that documentation for their family's record. But in general, so it sounds a little bit threatening when we talk about it in that situation, but actually is generally helpful for the nurse because the reason she's not turning off the Pitocin is because she's scared that the doctor's going to get mad at her.
Yeah. She doesn't want to get in trouble.
Yeah. She's going to get in trouble for slowing down this induction. And now she can document, no, well, actually the patient declined having any more Pitocin. So that's why.
It actually protects her too, because now we're clear. Patient requested it. It's not on you can wash your hands of this.
Yeah.
I love that.
It's a nice conversation ender too. If you don't want to continue this conversation, just saying that, it's kind of and cut.
Yeah. Like a little button it up. I'm done talking.
Yeah.
Just document. This is my decision. I love it. So helpful. I love these tips. They're so good. We could go on for days. You have so many of them. I want to ask, go ahead.
Oh, let's just say, let's just do one more. You want to talk about chain of command?
Oh,
let's do one more tip.
This is a really important one. This goes back to what we were talking about before when I mentioned that having partner vet the nurse. And because if you have a nurse who's with you on the day you're giving birth, you are going to remember her for the rest of your life, what she said to you, how she treated you, all of that. And if you have a nurse who really doesn't want to be hanging out with you, then that's going to influence the way your day rolls out. So if you're not loving the nurse, odds are she's not loving you either. So you can do the kind thing both for yourself and for her, and you can move up the chain of command. So if you're not feeling like your nurse is aligned and she's not going to be able to be supportive of your wishes, then you can head out to the nursing station and ask to speak to the charge nurse. So there's a hierarchy in nursing, and the charge nurse is above these floor nurses. She's keeping an eye out for everyone, making assignments, changing assignments as needed. So you can go to the charge nurse and you can say something like, We're in room 105 and we've got Nurse Sarah with us. She's been lovely. And we're not sure she's going to be able to support our wishes during our birth. We would love another nurse as soon as possible. One who's going to be supportive of X, Y, and Z. Lay out whatever it is that you want. And then they will do that for you. If you're not getting any help from the charge nurse, you can move up the chain of command. There's a nursing director who's there, a nurse manager who's there. And at the very top of the chain is someone called the house supervisor who's overseeing all of the hospital. So you can move your way up that chain as needed. But generally, just going to the charge nurse is going to get you what you need.
Well, and just to clarify, this isn't just in the case of firing your nurse. You're not going to have to go past the charge nurse for that. But
on occasion.
Okay, maybe. But if this is any time that you are meeting, like you're not getting either the best treatment or you're not being heard by the people in the room. Like, here's an example. Let's say you're declining antibiotics for some reason, and the nurse is like really badgering you about it. You say, well, I would like to talk to the charge nurse. Charge nurse comes in and she also maybe is like being really insistent. No, you have to have these. There are no alternatives. You've got to have antibiotics. And let's say you've decided in this situation, you don't feel they're necessary. You don't want them. And the charge nurse is also treating you that way. Well, then you can go up that chain of command to the nurse manager or to the nurse director, or all the way up to the house supervisor house supervisor is there 24/7. So even if this is 2 a.m, that's somebody you could talk to say, I'm declining, I'm making an informed decision to decline this treatment, and they're not taking no for an answer, and just keep going up until you're heard, because there's somebody else to talk to. We have a friend who will even get the hospital lawyers on the phone to back her up and be like, look, this is what they're telling her. And then I think so far the lawyers have always taken her side because they, he knows the law.
When a patient is ballsy enough to call the hospital lawyers, like, you listen to that patient.
Yeah, exactly.
That is not someone you want to mess with.
Yeah, exactly.
Well, I think that's something too to say here is that there can be a lot of fear about asking for support from someone higher up. Like, oh no, what's going to happen? And the truth is that when you start moving up the chain of command, everything changes for the better. People roll out the red carpet because suddenly they realize, oh, these aren't just any parents we're dealing with. These are really educated, informed parents who get different treatment.
Absolutely. Wow. And do you also see this method effective in if they needed to request a new doctor or resident? Sometimes you don't know who you're going to get or who's on call. It might not be your preferred care provider. It might be someone else on their team. And it could be, I've had clients actually fire their doctor in labor. And most women have no idea you can even do that. How would you recommend going about that if you really felt like that was not a good situation and it wasn't playing out well?
Well, there's always going to be somebody. I would say most hospitals, larger size hospitals, are going to have a hospital list who is sort of a Jack or Jane of all trades and can move from, place to place in the hospital. And so inevitably, if you fire your doctor or your midwife, the odds are high that you'll have a hospitalist that you can call in, or perhaps a colleague from their practice who's able to come and be with you. So most of the time, there will be someone else.
And I would go to the charge nurse for that, and she can help make those arrangements.
Yes. And like you said, when you make those kind of waves, as scary as they are to speak up and make that kind of request, but I love how you phrased it even. It shifts the energy of it. It's like, I'm requesting support. I'm looking for support in this way. Suddenly they go, oh, we need to be on our best behavior. We need to really deliver here. This is a patient that's not satisfied. We don't want to get bad patient responses. We want to avoid a lawsuit. So whoever we send them, they're going to be on their tippy toes, making sure like we are listening and we are here to support you. They're instantly going to give you a higher level of care.
And I think it's really important to note here that you can decline anything, but you can't demand anything. Right? You can't say, I want a water birth with an epidural, and go up the chain of command until someone gives that to you. You're not.
Some things are just
right?
not possible.
Yeah, some things are not possible. So this is for like Or you can say, like, I want an induction, but I don't want continuous fetal monitoring. If you're on Pitocin, they're going to shut off the Pitocin rather than not
Yep,
monitor
not
you.
possible. Yep.
So you can't demand anything, right? But you can decline anything that doesn't feel right to you. And you should be able to expect respectful treatment. That's something you should be
Yes.
able to demand, is that you're going to be treated with respect, that you're going to be heard. So if you are being this patient, don't be afraid to be the patient that goes up the chain of command, that really demands respectful treatment, and do it in the most humane way, right? Like, you don't have to get nasty. You can just express gratitude at every turn. Like, I know you're all trying your best. We feel like we're not being heard. We'd like to speak to this person. And just continue, like, stay calm, stay respectful, stay gracious. And as we like to train our advocates, treat people like ladies and gentlemen, not because they are, but because you are, right? Even if you're not being treated well, you can still, like, take that high road, and you're going to get farther than if you do. And we totally understand if you blow up at, at the people who are abusing you. That is okay. But if at all possible, when you're being that squeaky wheel, do it with graciousness.
Yeah, that's such a good tip. And I know we're kind of winding down and running out of time here, but I would love if women want to learn more about these tools that are so incredibly effective and helpful, that really empower you, give you confidence, and what you guys teach. Can you tell us a little bit about your offerings and how women can work with you or learn more from you?
Sure. Well, they can come to intentionalbirth.co. That's our website. And we have a parent program. The Intentional Birth Parent Program is a really robust childbirth education, all online, self-paced. And we teach these advocacy tools. We have 24 of them, but we teach 10 inside of the program that are specifically for parents so that they can learn. We give them the opportunity to practice in the course of this module, and they're able to really learn how to embody advocacy and then hopefully go out and live it. But whether you're planning a medicated, epidural all the way, or you want a physiologic VBAC, this program will help you understand your rights, your options, and give you that secret menu at the hospital so you can have the experience that you really desire.
It's a physiology-first program. So we're going from the perspective of how do we optimize and prioritize physiology at every step of the way, including if you're being induced, including if you have a C-section or an epidural. How do we still focus in on and preserve physiology wherever possible? But it does come from a physiology perspective. I think important to note that if you have a doula working with you, she can license this program for a lot less money and get you in the door a little easier. So tell your doula about it and let her know that she can learn these tools from us too, because I think maybe a really important point to make as we're closing is that not every doula is prepared or equipped for advocacy. In fact, very few are equipped by their actual training. Most of them have learned it on the job. Some have learned it really well, some not so well. And so when you're hiring your doula, make sure that you ask these questions and find out what kind of advocate she's prepared to be, what kind of boundaries she has around advocacy. Maybe she still doesn't speak to staff, and maybe that's not what you need or want at your birth. Maybe that's exactly what you want. But make sure that you're aligned with your doula on that. And if your doula wants to learn more, then we are very happy to nurture her through her journey of patient advocacy.
Amazing. Thank you so much for sharing today with our audience and with just the incredible work that you guys do in helping patients and doulas advocate. Your programs and your content are just so practical and so helpful. And I just pray that, like, moms listening to this would feel even more confident going into their birth, wherever that birth is, because even in a home birth, you have to speak your desires and your wishes. So this is applicable truly to anyone. And like you said, I think you mentioned this yesterday, is that, like, this changes you, not just in your birth, but in every area of your life. You begin to own your voice, you own your power, your relationships change. And I think that that is so true. So I just want to honor you both for being here. Thank you. And definitely, ladies, check out their website, check out their resources, their trainings, their courses, especially the in-person ones. It will be worth every dime and minute that you take to invest in yourself and your birth experience. So with that, we'll see you guys next week.